A weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson, joined by the belle of the ball, Sarah Giosi. Good morning, Sarah.
Good morning.
We'll get to why you're the belle of the ball in just a moment.
Yeah,
Our guest in studio this morning is Dr. Ryan Wakim, psychiatrist with Mon Health. Good morning, Dr. Wakim.
Hey, good morning.
Hey, we're going to get into vaping, which is a very current topic that's been going around. More news coming out last week with state lawmakers weighing in on that. We're going to get to all of that as this program unfolds this morning. But both of you guys, well, everybody on that side of the table, as a matter of fact, was hanging out at the ball. How did the ball go on Saturday?
Yes, and you're talking about the Mon Health Ball, which was helping to raise funds for the new perinatal program, and I thought it went really well. I don't know. I thought it was lovely. It was a great evening. I have to say, the Giosis were there. Jeff Giosi was dressed by Daniels of Morgantown, and he looked like 007. It was really great. And I was dressed by Lavish Boutique, and it was really fun. It was a beautiful night and such an amazing cause. We got to hear from administration and physicians and various people from Mon Health, but also patients who had been majorly impacted and will be majorly impacted by the new perinatal program. So it's been really cool. And, you know, since we have Dr. Wakim in here, you're coming at that, and that's not what we're here to talk about today, but just for a brief second,
Sure.
Coming at it from a psychiatry point of view, when we're talking perinatal and we're talking about postpartum depression and anxiety from a family unit, I imagine you'll be a big player in that kind of a program as well.
Yeah, actually, so I've been involved. I'm not employed by Mon, contracted by Mon, but we've overseen their inpatient psych service for about 3 years now. So remember the CEO when I started there saying we do about 200 psych consults a year. And for the size of the hospital, I thought to myself, well, that seems very low. Here we are 3 years later, and there are some months we do 200 a month. So I'm a firm believer if you build it, they will come. And I think David and I and several of our meetings have come together and, you know, we share that sentiment, i.e. the Mon Ball this year compared to last year. And so what we've come together to do is really help develop this perinatal depression program where our company, Harmony, grwhealth.com, will end up being the referral source for those mothers in need. So we'll be the provider side of those patients and mothers and babies and families.
What an amazing partnership. And as you said, you partner with Mon Health in a number of different ways. And
Right.
today we're actually going to talk really specifically, Dave kind of gave a little teaser on this here, but about vaping. And I think what's interesting is getting your perspective on this, because we talk about it a lot from a just physicality, but now to talk about it from a mental health perspective is fascinating to me. But before we do that, why don't we start out? Why don't you just tell us a little bit more about yourself? You've kind of already started, which is great, but tell us a little bit more about yourself.
I never miss an opportunity to put a plug in.
Sure, yeah.
So,
That's good.
No, so I'm a psychiatrist here in the community, born and raised in Wheeling. Actually went to med school here at WVU, was a chief resident in psychiatry here, currently oversee 8 private practices in the region. Again, contract with Mon to work mainly on the inpatient psych side, but obviously a number of initiatives since David joined that we're working on, most notably this one. This one being the perinatal depression. And then from there, you know, we have a fairly large organization that provides all the different level of services someone would need from an outpatient psychiatric perspective, from, you know, social work, therapy services to medication prescribers. We're pretty progressive as a practice, so we do a number of things that a lot of other places don't do, like IV ketamine treatments, Spravato, TMS therapy. So we're progressive, we're firm believers, and if we can do it without a medication, we will. And that's so important, especially as you talk about perinatal depression, and in this instance, you know, the vaping epidemic as well.
So what made you choose psychiatry?
My canned answer is I didn't like anything else.
Yeah.
which is true. And I found myself at an away rotation at Vanderbilt doing radiology as a fourth year, which is not an easy rotation to get. And I was in this dark room all day looking at, CT scans and chest x-rays, and thought to myself, if this is where I'm going in medicine, I have some problems coming my way. So it was funny. I ended up with a neuroradiologist reading brain scans, and I had really enjoyed my psych rotation here at WVU, and again, didn't like anything else. And in a kind of a heart to heart with that gentleman, decided maybe psych is my field. So came back, did another rotation here before I had to, really do interviews and make a decision, and decided that was the path I would take.
Dr. Ryan Wakim joining us in studio, psychiatrist. When Mon Health Talk continues, we'll get into vaping. We'll look at the psychiatric side of that when we return. You're listening to Mon Health Talk on WAJR. Joining us in the studio this morning, Dr. Ryan Wakim, psychiatrist, and we're talking about vaping. It's been in the news. It's been in the news recently. We're going to get into more of that next hour as well. But Dr. Wakim, what was the intent or original intent of vaping, and when did it become so popular?
So it's funny, when I was in residencies, when it first kind of started to hit mainstream, and the initial intention was a lesser of two evils, right? If you could take out some of the known carcinogens of a cigarette and still be able to use nicotine, but potentially in a safer way, that was the intention. Almost like a nicotine replacement product, like a patch, but in a way that it also fixated on the habit side of smoking tobacco. It became popular because it is affordable, as more so oftentimes than cigarettes, and people have this sense of it's safer. At least that's the general consensus to this point.
Is it safer? That's the million-dollar question at this point, isn't it?
Where we are at the moment, it doesn't seem to be. I had jokingly said earlier, it's the old adage of the devil you know versus the devil you don't, meaning ideally it would be safer if it were FDA regulated, clean products. We knew what you were using, but unfortunately, 2/3 of those using some sort of an e-cigarette or vape have no idea what's actually in it.
We've been talking a lot about this in relation to the opioid epidemic, and in particular, we saw, not even necessarily opioid related, but we saw this even locally having an impact on our youth whenever it came to overdoses and things like that. So can you talk a little bit about how this relates to the opioid epidemic and how this could be impacting an overall drug problem?
Sure. Yeah, it's twofold there. So number one, it's well known, we used to talk about the gateway drug was marijuana, so to speak. And what we know is the earlier you get involved in any kind of substance use, whether that's alcohol, tobacco, marijuana, opioids, the more likely it'll snowball into other things down the road. And so, number one, we're what's very evident at this point through the CDC and NIH is that about 30% of those people who use e-cigarettes or vape end up going to tobacco next, and then from there, again, it can snowball. The other side of that is in relation to the opiate epidemic, going back to what I was saying earlier, you don't know necessarily what's in it. And so if you get one of these cartridges from a friend who may have been, in Denver, you don't know. And at the end of the day, these clandestine labs and these cartels and such, if they can push their product through any delivery mechanism, especially one that 1 in 4 12th graders use, they're going to do that and do it.
1 in 4. 1 in 4 12th graders.
1 in 4.
Wow.
That's it. Vaping and e-cigarettes have doubled in the past 18 to 24 months, and now it's to the point where one out of every 4 12th graders, 1 out of every 10 8th graders are vaping or using e-cigarettes.
Wow. That blows my mind. I want to get into some more of the nitty gritty of this, but before we do, let's provide a little context. Why are we talking to someone who focuses on psychiatry about vaping? Where's the connection here?
Sure. So a lot of people don't know or don't remember that a psychiatrist is a physician, med school trained, residency trained. And we often, in the old days, the Freudian days, we were very much psychotherapy on the couch. That's really not what we are for the most part anymore. We really do handle more of, medication-based progressive treatments, as I mentioned earlier, things like TMS. But one of the things we deal with as psychiatrists is substance abuse, and so that includes medication-assisted treatment with things like the opiate epidemic, like Suboxone or Sublocade or Vivitrol. And in this instance, it would include nicotine replacement products, Wellbutrin or Zyban. So we kind of deal in the medication side of how to usher someone out of an active substance use into a more stable, long-term recovery-based program.
How closely related, or are they related, mental health issues and substance abuse issues? Because it seems like we talk about them as if they are related. Are they related?
Absolutely. I mean, they're under the same umbrella, right? And 1 out of every 2 patients with a mental health issue have a co-occurring substance use issue, be that, tobacco use all the way through opiate, cocaine, etc.
Is it, I guess it's a chicken or the egg question. Could it be, and I'm just picking an example here, I suffer from depression, so I start vaping or drinking to deal with the depression, or it could be vice versa. I could be drinking, and that could lead to, and again, I'm just using those as examples here.
It's a vicious cycle, which is why the co-occurrence is so high. But yeah, I mean, tobacco, nicotine specifically, has been known, it raises ephedrine, adrenaline levels. So for someone who's kind of feeling, fatigued, low energy, depressed, apathetic, tobacco use or nicotine specifically can help, provide an energy boost to kind of get your day going. And so a lot of what we see in our realm is a lot of people self-medicate, and that includes nicotine, it includes tobacco, and it includes opiates and all the others.
Very interesting conversation. We will continue it on the other side of the break with Dr. Ryan Wakim, psychiatrist. You're listening to Mon Health Talk on WAJR. Joining us in the studio, Dr. Ryan Wakim, psychiatrist. We've been talking about vaping and all of those connections this morning.
You gave us that statistic about 1 in 4 12th graders using vaping materials. So for folks out there that are parents or are friends or are the 12th graders, what do we do? How do we educate ourselves, or what is your recommendation for dealing with this specific issue?
Sure. So as it comes to, well, let me back up. First of all, like I said earlier, a third of the time or more, it's you don't know what's in it. And beyond that, about 2/3 of the time in those 12th graders, they're actually using it in vaping just for the flavor. I mean, there's not even any nicotine or any other product in there. But again, unfortunately, there's all these different drugs now that can be vaped. Marijuana is very classically or commonly known to do that. And as I was just mentioning during the break, these drug dealers and such, they have been known to lace products that are popular with students, teenagers, young adults to begin that process of getting them hooked and addicted. So as a parent or as someone who finds himself using at this point, reaching out to a local mental health provider or even your primary care doctor or your pediatrician, just helping to get resources towards what educating and resources towards what we might be able to do to help. Because if there's no nicotine or substance in it altogether, and 2/3 of people or 12th graders are using it just for flavor, I think educating on truly the risks beyond just what you hear on the news would go a long way.
Is the number one goal to abstain altogether and then come see you if that hasn't happened?
Yeah, I mean, if you're using it for flavor alone, there shouldn't be any
Find
reason.
some bubble gum.
Yeah, you shouldn't be. There shouldn't be too much of a reason why you couldn't just stop. So yeah, absolutely. I mean, just being cautious about what you're putting into your body, no matter what that is, right? Especially if it's not controlled by the Food and Drug Administration. You just got to be careful about what you're using. So stopping altogether, absolutely. And if you can't, there are products out there, and there are treatment options for helping someone usher off of any kind of substance, let alone tobacco use, or nicotine use, into something that's safer and more long-term effective.
What's the most important thing to take away from our conversation today?
Most important thing is, I guess I would say, it's important that you understand what you're putting in your body. And if it's a fad, if it's a habit, if it's something you're doing to self-medicate, if it's something you're doing to fit in, you just got to understand that there's a lot coming out that we didn't know before that we know now that really does put you at harm's way.
We were talking about vaping on the show last week, and I said maybe one of the most dangerous things is we don't know what we don't know at this point still about vaping. So like you said, you don't know what might be in that cartridge or what the long-term effects may be.
Right. And those statistics are just starting to come out. And really until all these issues with lung conditions, et cetera, started to happen, it wasn't really a big push. It was kind of, it was not a big problem as compared to the overdose deaths and everything else going on. So as it's starting to actually impact our students and teenagers, we're starting to shed more light and understand more about it.
So if someone's listening and they want to find out more, or they're interested in just finding out in general, because we did talk a little bit earlier too about perinatal or in general psychiatric services, where do they go? What do they do?
So in the area here, you can always reach out to, again, your primary care doctor, Mon Health. But if you're looking or you're beyond that point, it would be our website, grwhealth.com, grow without the O. Phone number 304-460-5123. Or you can just Facebook, Google us, whatever you'd like to do, Harmony Health. And we'd be happy to match you with some resources.
And of course, we always send you to the Mon Health Facebook page. Always, you can find out more information there, get links, contacts, everything you need over at the webpage. Dr. Ryan Wakim, hey, thanks for stopping by this morning. Very, very interesting conversation this morning.
Absolutely. Thanks for having me, guys.
Of course, coming up next, it is the top of the hour news, Fox News local news, and then it's the talk of the town right here on the Voice of Morgantown, 104.5 FM and AM 1440 WAJR.